Monitoring and evaluation is an essential component of public health emergency response. In this video, I will be sharing with you some appropriate monitoring and evaluation designed to reflect better assessing the impact of the water flood disaster response with specific reference to substance use disorders and COVID-19. First of all, what is COVID-19? Coronavirus disease, COVID-19, is an infectious disease caused by the SARS-CoV-2 virus. Most people who fall sick with COVID-19 will experience mild to moderate symptoms and recover without special treatment. However, some will become seriously ill and require medical attention. Thus far, deaths and several illnesses from COVID-19 seem concentrated among those who are older and who have underlying health issues, such as diabetes, cancer, and respiratory conditions. Serious complications of COVID-19 are seen amongst drug abuse individuals, which include cardiovascular disease and other respiratory diseases. People who use opioids at high doses face separate challenges to their respiratory health. Since opioids act in the brainstem to slow breathing, their use not only puts the user at risk of life-threatening or fatal overdose, it may also cause a harmful decrease in oxygen in the blood, hypoxemia. Lack of oxygen can be especially damaging to the brain. While brain cells can withstand short periods of low oxygen, they can suffer damage when this state persists. Chronic respiratory disease is already known to increase overdose mortality risk among people taking opioids, and thus diminished lung capacity from COVID-19 could similarly endanger this population. Now that we have seen how COVID-19 functions, why do we monitor and evaluate substance use disorders who tested positive for COVID-19 in this scenario? Our first and main aim in doing so is not to waste resources. Objectives of the project accomplished will be of no use if the economy of the population in this area falls by the mortality of these COVID-19 patients and many other related factors. Secondly, it is important in creating evidence base for developing country interventions. Effectiveness of many health interventions in developing countries is not proven, and doing so will provide the infrastructure to evaluate global health interventions and move toward evidence-based global health. How do we monitor and evaluate in this scenario? Data measures of inputs, expenditures, outputs and outcomes will be measured and kept together. In evaluating development assistance, we need to look at the relevance, sustainability, effectiveness, efficiency and impact, which include ventilation and spacing as indicators of the quality and safety of those accommodation facilities using third-party monitoring. Data collection of those consuming nicotine patches and medications for opioid use disorder through the identified reports by on-site nursing staffs. Evaluating the experiences of substance use disorders who tested positive for COVID, and ensure they were put in separate isolation facilities. And finally, we need to ensure proper love and health care are given to these individuals tested positive with COVID and having substance use disorders backgrounds to reduce mortality rate as well as the economy of this community. This video is sponsored by Public Health Youth. Thanks for watching.